Hello, I'm Andrew Chu, Director of Research at the Institute. In this video, we'll be talking about health and healthcare issues affecting northeastern Pennsylvania as we begin 2022. Some of these are immediate and others are long-term. COVID-19 was set to be the third leading cause of death nationwide after heart disease and cancer. This fall and winter, COVID cases have surged in Pennsylvania compared to the summer of 2021 when we saw the lowest COVID activity since the start of the pandemic. Vaccinations remain a leading public health concern as a disproportionate share of hospitalized COVID patients were not fully vaccinated. As of mid-December, a large share of area residents were fully vaccinated, meaning they had one dose of the Johnson & Johnson vaccine or 2 doses of the Pfizer or Moderna vaccine. Fewer, however, have received an additional dose that is now recommended by many public health experts due to evidence of waning vaccine efficacy over time and the new variants. Both Lackawanna and Luzerne counties have considerably higher rates of fully vaccinated individuals than either the Commonwealth as a whole or the 8 neighboring counties. Lackawanna County in particular has seen strong results in vaccinations so far, including additional doses. While COVID-19 is perhaps the most immediate public health threat as we begin the new year, other long-standing health challenges remain. Personal behaviors, including nutrition, physical activity, and sleep, impact many health conditions. Tobacco use and excessive alcohol use are also associated with many negative health outcomes. The 3 counties that make up the Scranton, Wilkes-Barre, Hazleton metro area have a considerably higher rate of tobacco use than the state as a whole, 24% of adults compared to 18% of adults across Pennsylvania. The rate of excessive alcohol use is also higher in northeastern Pennsylvania. Substance use issues, which also include opioid use disorder, represent an important area of public health to watch in 2022 and beyond. The region also has a disproportionate older adult population and a higher rate of individuals with disabilities than the state and the nation as a whole. And these impact rates of diseases like cancer and heart disease and shape demand for healthcare services ranging from acute care hospitals to long-term care to home health. Another important set of issues to watch in 2022 is social determinants of health, the relationship between health outcomes and factors like age, race, ethnicity, income, housing, education, language, and sexual orientation and gender identity. Previous research from the Institute's Health and Healthcare Task Force has found that in northeastern Pennsylvania, the effects of these determinants on health outcomes is at least as strong as a statewide comparison. Having a ready and well-trained healthcare workforce is also critically important to the health of our region. An article in the Institute's most recent quarterly economy tracker analyzed data on the types of jobs that are projected to see the most growth in our area over the next decade, and healthcare jobs are well represented among them. Occupations expected to see high rates of growth include a number with direct patient contact, including personal care or home health aides, nurse practitioners, and physician assistants. Other occupations in the health field that are growing include managers in medical or health services and counselors for individuals with substance abuse, behavioral or mental health disorders. There's a 10-year projected demand for over 9,200 healthcare practitioners and technical workers and more than 20,800 healthcare support workers. In the 2-county region, there were nearly 3,000 job postings for healthcare occupations in the 30 days that ended December 13th, 2021. These included 815 active job ads for registered nurses, 265 for LPNs, 232 for nursing assistants, and 210 for personal care aides. In the Institute's most recent policy tracker, we dove deeper into public policy issues impacting the healthcare workforce. There's a growing physician shortage in Pennsylvania and the United States overall. Rural areas may be particularly impacted and see reduced access to care as a result. There has also been a growing demand for behavioral health professionals. While the region has a strong higher education infrastructure to develop the necessary clinical workforce, it is critical to retain these graduates. Policies like loan repayment programs for healthcare workers and consistent federal funding for graduate medical education are important areas to consider. In order to meet the need for home health workers, one of the most in-demand healthcare occupations, Pennsylvania must maintain competitive Medicaid reimbursement rates. Medicaid is the largest payer for home health services, driving wage trends. Competitive wages are important for attraction and retention of home health workers, especially amid wage growth in industries like retail and warehousing. Some policy changes have already been made to ensure a continued pipeline of health workforce. 2 recent bills have expanded the role of physician assistants in the Commonwealth, and Pennsylvania has also joined an interstate compact to recognize nurse licensure across state lines. From preparing and retaining healthcare workforce to tackling the COVID-19 pandemic to addressing chronic diseases and long-term systemic disparities, health will remain a key area to strengthening the communities of northeastern Pennsylvania. Much of the data and analysis I've talked about can be found in the Institute's most recent quarterly economy tracker, policy tracker, community-based research task force reports, and the 2021 Regional Indicators Report. All of these are available for free on our website, institutepa.org. Thank you for watching, and we look forward to continuing to bring you the latest data-driven insights for northeastern Pennsylvania.